Hello everyone. Today we're going to be doing our second video on tension pneumothorax. I'm going to skip some of the physiology as it was discussed in a previous video, and we're going to jump right in. We have two videos that we are reviewing today. The first one is going to be a 57-year-old male coming from Australia that was involved in a motorcycle accident, and our second is going to be a 68-year-old male from Texas that has a gunshot wound to the chest. So we're going to go ahead and jump on in right away.
So tell me exactly what's happened.
There's a motorcyclist come around the bend and went off the road and hit the ditch. And
Okay.
really, at the moment, he's pretty smashed up.
At the state's Emergency Communications Centre, a call for help has come in from the scene of a motorcycle crash 200 kilometres away in the Victorian High Country. Intensive care flight paramedic Matt is now on the way with an air ambulance crew to rescue the motorcyclist.
Fully departure, maintain upwind to advise, please take off.
Airspeed's alive.
Okay, is he awake?
What, he's awake yet?
Yeah, okay.
He looks a bad way though.
We'll keep the helmet on, okay?
Maybe leave the helmet on. Leave the helmet on.
Yeah.
Don't do it. Yeah, just loosen it.
The accident victim reportedly has a collapsed lung and is in danger of going into respiratory arrest.
We suspect that perhaps a broken rib has punctured the covering of his lung, allowing air to come in around his lung. And the only way to relieve that is by putting a hole into the chest to allow that built-up pressure to escape. If you don't allow that to happen, that person will go on and die.
Dust everywhere.
The helicopter is landing at Mansfield Airport, where the road crew is waiting with their critically ill patient for Matt to take charge of the situation.
On the ground, fan 0.
What's going on?
So I've got Gavin here, he's 57. Gavin was riding a motorcycle approximately 80 kilometres an hour, failed to negotiate a bend.
Gavin was taking part in a charity ride when he lost control of his bike and crashed into rocks.
So it looks like that even before...
In a charity ride when he lost control of his bike and crashed.
So it looks like that before even Matt showed up, that the paramedics tried to use a chest start on this patient, and it sounds like that it wasn't successful. It sounds like he's still having some problems.
Into rocks. His son Billy was travelling ahead of him at the time of the accident.
When I rocked up to the scene, I seen his bike upside down in the ditch, and it was... I didn't know if he was dead or alive. I was just telling him it's going to be all right. The ambos are on their way. Yeah, it was just a horrible feeling. Horrible.
Got a pelvic wrap on? Gavin, give your toes a wriggle for me, mate. Good man.
Miraculously, Gavin is showing few signs of external...
So right now, Matt is going to use the ultrasound to look inside the chest. Unfortunately, it doesn't show it, but when there is no pneumothorax, using the ultrasound, you can see the lungs wiggle around a little bit. And when there is a pneumothorax, what you see on the ultrasound is the lung is pinned in place. And it's pinned in place by the air or also sometimes blood. When there's blood in the chest, it's called a hemothorax. Hemo meaning blood, referring to blood more specifically. And so, again, it's too bad that they don't let us see the ultrasound image.
Injuries due to his full leathers and helmet. But internal injuries are now threatening his life. A suspected collapsed lung is Matt's first priority.
Gavin, how you going, mate?
So the collapsed lung is our first priority because it's causing the instability, the hemodynamic instability. In a moment here, I think they're going to review the vital signs of this patient. And so when someone's really sick like this, one of the things we want to do first is to address the most serious issue. And in this guy's case, his most serious issue right now is that pneumothorax.
Yeah. Mate, your oxygen levels are pretty low. I'm concerned you've collapsed your lung, which is why they put that needle into your chest, but it's not doing a great deal for you at the moment, mate. So we're going to try and give you a bit more pain relief and see how you go with that and see if we can get you to breathe better. And if you can't, I'm going to have to put you to sleep so we can take over your breathing and get you back to Melbourne, mate. Sound reasonable? You're the boss. Righto.
Gavin is very sick. He's got a really fast heart rate. He's got a really fast respiratory rate. His oxygen levels are very, very low, and his blood pressure is low as well.
Nice big vest for me, Gavin.
So everything Matt just described are the classic findings of attention pneumothorax. We're going to listen to them one more time.
Gavin is very sick. He's got a really fast heart rate. He's got a really fast respiratory rate. His oxygen levels are very, very low.
So tachycardia, tachypnea, low SpO2 are his symptoms right now.
His blood pressure is low as well.
And he has the decreased cardiac output, so he has the low blood pressure.
Nice big vest for me, Gavin. You're doing really well, mate. We'll give another 20 of ketamine, please.
I can do that.
So I'll attempt to do a needle decompression on Gavin first, and if I don't get the results that I want from that, then I'm going to be forced to take more drastic action.
So they've already tried one chest dart. Matt is going to try to do a second one. He's trying to go from the least invasive procedure to the most invasive procedure, and if the issue can be solved with just a second chest dart, that's great, and he'll be able to leave that as is until they get to the hospital for definitive care.
So sharp out, guys.
Have it available for me, please.
Yeah, sure.
Up in the remote Victorian high country, flight paramedic Matt is trying to save his critically ill patient after an horrific motorcycle crash.
Righto, guys, so this is the plan. He has got oxygen sats at 74% at the moment, which is very low, obviously. So it'll be a one look. If I don't get a view straight away and he starts to desaturate very quickly, I'll pull out early and we'll go straight back to back valve mask ventilation. Is everybody?
So with the SpO2 being at 72%, we take that number minus 30, which is 42. So he's moderate hypoxemia, I believe, if I remember correctly.
Everybody ready?
With oxygen levels still too low, Matt puts Gavin into an induced coma and takes over his breathing.
Saturation still holding.
Matt's going for the intubation. This blue thing right here is called a
For
bougie,
his breathing.
and it's just a smaller device that is sometimes easier to get into the trachea. And as we can see here, he has the endotracheal tube around the bougie. So when the bougie goes in, he can just pop off the endotracheal tube and get that into the trachea. Pretty common, so you might see it.
I'd been told that he'd been put in a coma, but I didn't know the extent of his injuries. It was bad. It was bad. We've been together for 30 years. He's my soulmate, I suppose. Yeah, he's my best friend.
We've got sats at 74 at this stage.
So what's happened is they've tried the second chest dart. It's not relieving the pressure like they would like it to, so there's probably other issues going on. There's probably some blood that is in the chest cavity that's not able to be relieved by that needle. And so he's still in obstructive shock, right? So that air or blood is still pushed on his heart to the point where it can't beat like it usually does. He's having decreased cardiac output, and that's why his SpO2 is low.
So there's a build-up of pressure from both air and also blood inside his chest there.
Gavin is still not responding to treatment, and time is now critical. With hospital 30 minutes away by helicopter, Matt has no choice but to carry out one of the most risky procedures that can be performed by paramedics in the field.
Now, he is likely going to tension with us doing this, so I would like to move.
And so Matt said he's likely has a tension still with the bag valve mask. And so if that tension's not relieved and you're continuing to add that air over time, of course, that tension pneumothorax will get worse and you'll end up causing cardiac arrest in your patient.
Fairly swiftly. So the next thing that we need to do is what's called a finger thoracostomy, which is an invasive procedure where we make an incision into the side of the patient's chest so that any pressure that's built up inside surrounding the lung can escape out of the patient's chest.
So Matt needs to make a bigger hole. There's still stuff in there. The needle isn't big enough to relieve all of it, so he's going to make a bigger hole. What he's doing is just one step shy of a chest tube. Basically, the only thing he's not going to do is use the big tube that they have in the hospital.
So sharp out, guys.
Sharp out.
He's a big boy, so locating his ribs can sometimes be quite hard, so we've got a fair bit of tissue to cut through. It's a fair way in.
Yeah, we'll just wait until Matt.
There you go.
So it doesn't show it here, but what he did is he inserted forceps into the chest and he pulled apart really hard, separating the muscle, separating the skin, again, causing a bigger hole. And
there's your hemothorax.
It's blurred out here, but what just happened is there's a bunch of blood that just ran out of the body right here. And so again, he was having the problem of blood accumulating in the chest as well as air. And the only thing that was really going to relieve that blood to the point where it was going to improve his situation was to make that hole.
The blood and air have been released from Gavin's chest. Now the team must wait to see if his oxygen levels have improved enough to get him into the helicopter.
There's definitely air coming out with each breath there. The bleeding seems to be slowing down as well.
Quite a bit of blood that we could see right there.
Which is good.
And all that blood came from his chest. From inside the pleural cavity.
Alright, Sats at 93. Can we have a unit of blood, please, mate?
Beautiful. So Sats came back up, so he relieved that obstructive shock. Now the heart is able to circulate that blood throughout the body, which in turn increased that SpO2. They're going to be hanging some blood now. In these trauma patients, when there is blood loss, when we give the blood, the most important thing that we're after is to increase that hemoglobin. The hemoglobin is more important than the PaO2 because the hemoglobin is able to transport that oxygen, right? So no hemoglobin, no dump trucks, no oxygen transport. So they're going to hang a bag of blood to help increase the amount of hemoglobin that he has.
Push this in.
The oxygen levels have improved, but Gavin's low blood pressure is now the problem.
Let's get that blood.
So thinking back from working to our biggest problem first, so we addressed the pneumothorax. Now we need to address the low blood pressure. The superior way to address low blood pressure in the trauma patient is whole blood.
Up and going. Get a 12-lead ECG, make sure we're not missing anything. I'm very concerned about Gavin. I've taken him from a high conscious state and I've put him to sleep. I've cut a hole in his chest. I've let air out. I've let blood out. I'm still very concerned for him. His blood pressure's low. His heart rate's fast. He's bleeding somewhere else. So what he needs is to be moving towards a hospital.
So still with the fast heart rate means he's losing blood internally. And so another thing the blood is going to help. If you give someone normal saline through an IV when they're a trauma patient, it can also be harmful for their pH. That solution is acidotic and it can make them further acidotic and cause cardiac arrest. With blood, you're not going to have that same problem.
Let's get him across and get him sorted. He needs to get to Melbourne.
All right. And let's take a look at the ending here.
Life after crashing his motorbike. The injury toll included 14 broken ribs, a fractured collarbone, and a pelvis smashed in 4 places.
When you have a fractured pelvis, that's one of the areas you can lose the most blood. The pelvic cavity is pretty large, and so when that structure is disrupted, it just creates this huge vat, basically, where blood can leak and escape in.
Emergency surgery on a collapsed lung got him to hospital alive. But Gavin's wife, Sharon, and sons, Jack and Billy, are still coming to terms with just how close they came to losing him.
Awesome. So it looks like he made a full recovery. Love to see it. Our second video is going to be it's a 68-year-old male with a gunshot wound to the chest.
Building is going to be set up at the...
Alright, so we have an entrance through one here. Going through. He has lung cells. Blood pressure is 85/62.
So right away, low blood pressure, not good.
Okay.
So do you see how what I'm thinking with the way that the gunshot wound is? In through here?
He's got crepitus under his left axilla.
Sounds good.
Feel this crepitus here?
Yeah. Okay, well, we know that one's down. Yeah. Alright, pull the side. We're losing it. You get your lines, get your blood. I've got a 16. Okay, sounds good. Let's hook our blood in. You can come over to the side.
Blood's working.
Good. Let's get those tabs.
So right away, they are getting blood, replacing that hemoglobin, helping with that fluid resuscitation. He is hypovolemic, so he has low blood or low fluid volume more specifically.
That's on, but that's fine. Yep. But his cardiac arrest will be from exsanguination.
Exsanguination just means blood loss. And so in a cardiac arrest situation, the only thing that can fix that problem and bring pulses back with that patient is going to be blood.
Sure. Get ready for,
Pass me the IO.
And then as soon as you get the IO in, let's get him ready for intubation.
Ooh, nice IO. Nice IO.
Get him ready for all his monitoring. Make him naked.
Little pressure, bud. All right. There. You ready for blood? There you go. Holy crap. I'm watching this bag turn itself inside out. It's going so fast.
When you start going to the LZ as well, you can start your driving.
You need to have another bag of blood, please,
This bag's empty.
Alright, sounds great. We'll see what his pressure is. We're going to probably open his 5 ketamine's given. Let's drop our sex and be ready for that. We'll get him intubated after we open his chest wall. You ready?
So this patient's issue is more obvious than our last patient. And so instead of doing a chest dart, they suspect a pneumothorax. And so they're going to choose to open his chest wall right away.
Jeff, let me throw economy be done. Downward, there you go. Perfect. Good enough. Alright.
In.
Feel pop? Okay.
Yep.
Pull apart, hard. Alright.
There it is.
Significant hemothorax on the left. Alright.
So really big hemothorax in this guy. We're going to watch that blood come out one more time just to appreciate how much it actually was and really highlight this guy's problem.
Pull apart, hard. Alright.
There it is.
Significant hemothorax on the left.
So with that blood coming out, that's probably going to solve most of his problem that's taking place inside the chest wall.
Alright, put your finger in there and just get it as wide as we don't need it until we're ready. Let's put the cannula on to get him doubly oxygenated. I got you. 94 down.
So what they're doing with this patient is they're hyperoxygenating him. Essentially, they're trying to wash out all the nitrogen that is in the lungs. It gives the patient more oxygen when they go to intubate. When he's getting intubated, he's not having an oxygen supply. And a patient as sick as this, that can be a real issue, even if they become hypoxic, even for a short amount of time. And so it's true that nitrogen washout can cause atelectasis, right? It can cause that absorption atelectasis, that oxygen absorption atelectasis, but it's only being done short term. And after this procedure is done, they're not going to continue with that large amount of oxygen that he's getting.
Okay, sounds good. Well, he's 96 on ours. I don't think he's got an oxygenation problem. I just know that when we intubate, he'll arrest.
99/60.
Perfect.
And so they want to get his blood pressure up. They want to relieve that hemothorax, because when they go to intubate, you're providing more increased positive pressure. And if there's already a compromise in cardiac output where the heart's already struggling and you introduce even more positive pressure without solving the problem, that extra positive pressure can cause him to go into cardiac arrest right away. So in order to avoid that, they're relieving that hemothorax, they're getting his blood pressure up before they go into intubate him.
So we got blood going into both?
That one going over there.
Keep it on.
Okay. We got another blood pressure going, 100/63. I am convinced that with the continued infusion of blood products that he will hopefully, and we can resolve his tension pneumo, he won't arrest. We got one more blood pressure.
I got 119/71, sir.
Okay, let's go. Let's push this to acetylcholine, Nick.
Sucks.
TXA, do you?
No, sir.
All right.
I got 104/58 stats with 100%, heart rate 82.
All right.
So this paramedic is using a video laryngoscope for this intubation. We can't really see, which is too bad.
Glottis. Let's go a little deeper. There you go.
Oh, right there. It's really hard to see, but right there is the epiglottis, so we can see what we need to see, or the paramedic can see what they need to see for a successful intubation, rather.
All right. Sure. Coming out. 1735. Do you have an end-tidal waveform over there?
Yes, sir. End-tidal 43, good waveform.
Excellent. I'm going to take this candle off. You hold.
So they had a good waveform capnography, which is one of the gold standards when you confirm that the intubation was successful. If the endotracheal tube ends up in the esophagus, you're not getting that return of CO2 because that CO2 only comes from the lungs. So having end-tidal CO2, that waveform capnography, is an indication again that that endotracheal tube is in the correct place.
Air Medical Services helicopter crew assumed patient care from the ground EMS crew and continued the warmed, whole blood transfusion during the flight to a regional level 1 trauma center. Patient went directly to the operating room from the helipad, underwent definitive operative management, and was ultimately discharged home on hospital day 9.
Awesome. So we had a great outcome for that patient as well. Well, thanks for watching, guys. We'll be back in a few days, and we'll be talking about asthma in our next video.